Our next guest, Dr. Jonathan Burns, is here today to discuss the benefits of epidural and pain management. So welcome to the show, Jonathan. Thank you for being here. Can you tell us why you decided to get into the practice of pain management?
Sure. I chose to specialize in pain management because I saw the profound impact that a small procedure or a simple procedure could make in a person's life. I mean, it could really turn things around for them. And sometimes people were kind of stuck in a rut and they didn't know what to do, and something as simple as like a small injection or an epidural or something like that could really change their life. And
so how do people know when they should come to you for an epidural, and what is it?
Well, an epidural steroid injection is a minimally invasive procedure where an anesthetic and a steroid is placed in the patient's spine around or near the area that's causing their pain or their problem.
And this pain can be caused from a number of things, accidents, or what other types of things do you see?
So a lot of motor vehicle accidents, falls, just wear and tear. You know, I have a lot of patients who they're doing fine and they twist and to pick up a pen or something and they get nailed with pain in their back, shooting down their leg, like a sciatic type pain. Epidurals in particular can help people who have disc problems, like degenerative discs, spinal stenosis, a herniated disc. All those diagnoses can benefit from an epidural steroid injection very well.
And is it a one-time thing, or do you determine, depending on what their situation is, how many times they have to come back?
That's a great question. Sometimes people have a problem and it needs to be fixed right away. And so we do whatever we can to get that pain under control. Sometimes people need like a series of epidurals, and that's been shown to be effective in spinal stenosis, for example. So we'll do a series of like 3 injections, maybe 1 or 2 weeks spaced apart. And that's good because the epidural will bring down the pain and it may start to come back. Then you can hit it 2 or 3 more times, and it seems to last a long time after that.
And the reason that it lasts a long time after that is because why? It's relaxed the tissue around it, or what actually happens once you get an epidural?
So the steroid and the anesthetic both decrease the inflammation around where the disc is damaged or where it's herniating out. It doesn't shrink the disc, but a lot of people have called it a Band-Aid. Which is not a bad analogy, because if you cut yourself, you put a Band-Aid on there, and that protects the wound as your body heals. With the epidural, you're basically covering the pain as your body heals from the tear or disc problem that you have.
So again, the benefits are it reduces, obviously, the pain. And what other benefits would a patient see from having one of these treatments or a series of these treatments?
Right. The important thing from my perspective as a pain management physician is to improve the patient's function and their quality of life. And that's really the whole driving purpose of it, and that's why I chose to specialize in it to begin with, because little things make a big difference. You know, if you want to be able to walk at your daughter's wedding or pick up your grandkids or something like that, epidurals and things like that can do that and restore that function to your life that you may be missing.
So how many different types of epidurals are there? How many? I went on your website and I saw there was a couple listed. Can you tell us what the difference is between them?
Sure. There's 3 basic epidurals. One would be an interlaminar epidural, which is between the bones. And that's good because it kind of covers a big area of the spine. So if someone has like 5 or 6 bulging discs in their neck, their back, or their mid-back, that's a good procedure because it's going to cover that whole area.
So this is between your discs you're talking about, or your bones in your back?
Between the bones, between the lamina. They're called lamina, between each level. Transforaminal epidural is an injection that's a bit more specific. So if someone has a disc herniation that's off to one side and it's hitting that nerve and irritating your leg, for example, you can put a needle right near there and deposit the steroid and the lidocaine right on that spot, and that seems to work really well.
And how long of a procedure is it when somebody goes in from beginning to end? I mean, 10 minutes, 20 minutes? I mean, how long does it take?
Usually about 5 to 10 minutes.
Okay.
It's a pretty quick procedure.
Okay.
Sometimes we do bilateral on both sides, and that's really good for someone who has a disc bulge right in the middle,
Yeah.
and they've pain down both their legs, and you can kind of treat it from both sides.
Okay. And again, once they've seen you, you can determine whether they're going to need a series of treatments or not. And you said some people only need one.
Correct.
So is that because they've like you said, maybe bent down and just strained themselves, and they'll be good to go from there?
Exactly right.
Yeah.
Sometimes
Okay.
people are in an acute episode.
Yep.
They need something, you know, they're taking Tylenol or ibuprofen and they're just hurting.
Right.
The epidural is perfect for that because it'll shut down the pain, they get back to their life and they heal up and they don't need anything else, no surgery or anything like that.
Okay. Wonderful. Well, I really, you've enlightened me on a lot of things, and as somebody that has back pain, I will keep that in mind next time I need you. So thank you for being with us today, and we'll see you on upcoming shows.
Okay, it's been my pleasure.
Great.
Thanks so much.
Thank you. Thanks for tuning in to the first episode of Aging Gracefully on Suncoast FYI. Join us next week for more discussions and advice to help you live a happy and healthier life, no matter what your age may be.